Welcome, everybody, to my February Department of Medicine update. I know it's a dreary February, but we do have a lot to celebrate and look forward to this month. So I want to talk a little bit about the exciting things that are going on within the department as well as outside in this month. So first of all, we are celebrating a number of events and holidays. First, Lunar New Year, which starts on February 10th, is a very festive, exciting time of the year. It's the year of the dragon, and we look forward to opportunities to celebrate that. Also, Mardi Gras will be happening later on, and then finally Valentine's Day as well for those of you who celebrate that also. So really laying the groundwork for spring rebirth in this dreary little month, but we're going to try to really keep the spirit up and make sure that we get a chance to celebrate within the department. And you'll see on the website there are a number of opportunities to do that. There are also screenshots and information for you to share within your units and divisions. The other thing I wanted to mention is that we are still looking at updates for the chair search. And the good news is that all of the first round interviews have been conducted in January. And we're looking forward to the search committee starting to look at second round nominees and candidates for second round interviews. And then following that, at some point, there will be third round interviews, which I think we've discussed before. Generally, the third round interviews will be a very select few and will involve town hall opportunities for all of the department members to participate in. So we're looking forward to that in the coming months. But it looks like we're through the first round, which is really a good timing for the committee. And we thank them for that work. Regarding the search for the DFA to replace our beloved Kathy Garzio, we are in the process of working with the dean's office to settle that. And I expect in the next few weeks, we'll have some opportunities to review applicants, and certainly the whole department will be involved in some way in looking at that selection process. And I'll probably have more information for you in March. Now, other areas to celebrate, of course, is that February is Black History Month. And it is a month not only of celebration, but reflection of the rich history and accomplishments of Black Americans. And we reflect, of course, on the progress that still needs to be made in this country and elsewhere. So, for example, here in the U.S., we have only 6% of physicians who identify as Black Americans or Black individuals. And yet Black or African Americans represent 14% of the U.S. population. And not only is this important for representation, but it really does help us understand the equity of healthcare in our populations, in our communities of color. So really important for us to continue to strive not only to recognize our Black and African American colleagues, but also to increase the numbers of representation in all fields. And that is one way that we can do that is by celebrating the accomplishments that we see in that community. So we also have a special medicine grand rounds programming this month. So this month, all 4 of our grand rounds will feature celebrated and noted African American or Black speakers. And I encourage you to go to the department website to see who these are. And we will be there celebrating and learning from them as well. One other area of excitement here that I'd like to showcase is our REACH HBMC Summer Research Program. And this is a high impact program for students in the summer. We offer students from a historically Black medical colleges 8 weeks of summer research here with our Stanford mentors, along with a stipend. This program began in 2017 through the Presence Center. That first year, we hosted 2 students from Meharry, and that program has continued to grow and thrive. And now, beginning in 2022, with help from the Dean's Office REACH initiative, it has expanded across the School of Medicine. I would also like to thank our Vice Chair of Education, Pedram Fatehi, as well as our Presence Executive Director, Sanu Thadani Israni, and our Program Administrator, Arya Small, who have really been the key drivers of this REACH HBMC summer program. Now, I'd also like to mention that February is also American Heart Month, and this again is a very important area of interest, pride, and concern, all wrapped up in one, not only for the world, but for our own department. As we all know, heart disease is the leading cause of death in the United States, responsible for about a quarter of all deaths in the US. And yet, a document that just was published this week by our own faculty member and leader, Joe Wu, who is also the president of the American Heart Association, wrote an article about the fact that less than half of all Americans understand or recognize that heart disease is not only a killer, but the number one killer of Americans in the United States. And so we really need to do more to work around equity and health literacy for all Americans. And I want to recognize not only Joe Wu, but also Fatima Rodriguez and our colleagues at the Center for Digital Health, and all of you who are working in these areas of cardiovascular health, health equity, and health literacy to help people understand that this is an important and preventable cause of death. Now, I also want you to think about ways that you can help take care of your own hearts. Again, during Valentine's month, these healthy hearts need to be cultivated with a healthy lifestyle, including a healthy diet and exercise. Managing stress is also an important part of cardiovascular wellness. And maybe give you a small piece of homework to take with you this month. And that is, what is one small change or new habit that you can incorporate into your routine to increase your cardiovascular well-being? Maybe next month I'll tell you what mine is, but I have each month tried to strive to do a little bit more to improve my own heart health. So I want you all to stay safe in this stormy weather. Remember, this, as I said before, is planting the fertile soil for the rebirth that we see in the spring. So it's good to have the rain, but it is a bit dreary. Let's celebrate American Heart Month, Black History Month, all of those wonderful events that we're seeing this month as well, such as Chinese New Year and Lunar New Year, and Mardi Gras, Valentine's Day. And I'm sure I'll have lots of exciting updates for you again in March. Take care, and thanks so much.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.